I'm Olivia Salmon and I'm a nurse injector, and today we're going to talk about Kybella to contour the jawline. So Kybella is a non-surgical fat reduction technique that's primarily used for under the chin and the jawline and sometimes the fat pad around the brow fat and some other small fat deposit areas. Today, Beth's main concern is kind of cleaning up her jawline here. And one of the main things we do for jawline is fillers. Sometimes you use fillers to sharpen the jawline, but in Beth's case, and what is often the case, is there's a fullness right in this area. And even if we put fillers in to tighten her jawline, she's still gonna have a little fullness here. And that's where Kybella comes into play. It'll kind of decrease that bulk to define the jawline more medially. Kybella is made of deoxycholic acid, which is naturally found in your gut, and it breaks down fat or lyses fat. When it lyses that fat cell membrane, it bursts open. So that bursting is where you see the swelling that's typically seen with Kybella. So this is one treatment where swelling is a good thing. We actually want to see swelling because then you know it's working and it's destroying that fat cell. The other mechanism of action with Kybella is that it causes skin retraction or skin tightening. So at about 4 to 5 weeks after our treatment, macrophages come into the area, they stimulate fibrocytes and they cause megacollagenesis. All that to say that that is the basis for our skin retraction and our skin tightening. And Beth and I talked about this, and we know it's not going to be a facelift type tightening, but it's just going to help when we remove that fat pad to help her jawline snap back up to kind of give her more definition. Kybella is generally not a one treatment procedure. It can take more than one treatment. The jowl area is usually less than under the chin. It may take 1 to 2. It depends on how much fat you have in the area, but we'll kind of reassess her at 4 to 5 weeks after this treatment and see if she needs a second. But the beauty of Kybella is that once we get rid of those fat cells, they're gone for good. You have all the fat cells you're ever going to have at puberty. So as you age or get older, you don't get more fat cells, they just get bigger as you get bigger. So when we remove a chunk of those fat cells, we'll just leave a thinner layer of fat cells in that area than she had before. And Beth and I have talked about what to expect as far as after the procedure and during the procedure. But the main things are swelling, and we know that that's a good thing. We want to see some swelling. You can certainly have some bruising in the area, and she's been avoiding Advil and aspirin to kind of help decrease that risk. You can also have some numbness in the area, and that varies from person to person on how long that lasts, usually 1 to 2 weeks or so, okay? Do you have any further questions before we get started?
No questions.
Okay, great. So we'll let Beth numb with some ice packs while I draw up her Kybella, and then we'll get going. Okay, so we're about to get started. Miss Beth here has been numbing with some ice packs, and we put a grid on, and that just kind of tells us where we're wanting to place the Kybella, and this is the number of injections she'll have just for this jowl area right here. It goes pretty quick once we get started because the longer it takes, the more burning she'll feel. The agent does burn a little bit when it goes in, so if you go faster, she'll sting for less time. But all in all, once we get started, it'll probably take us about 2 minutes. Okay.
The pricks weren't bad,
Yeah.
but I am feeling like
The stinging, kind of a constant stinging. And that'll wear off pretty quickly, but you'll feel that probably on your ride home as well. But then most of tonight it'll feel tight and probably start to get numb towards the end of the night. You can take Benadryl tonight, that can help with swelling. You can take these home and refreeze them and use the ice again.
Okay.
Avoiding high salt foods can help with swelling as well, and sleeping with your head elevated.
Okay.
Great, and I'll check on you tomorrow to see how you're doing. Otherwise, we follow up in about 4 to 5 weeks
Okay.
to see if we need a second treatment for the year, okay? Okay. All right, so that's all there is to it. It's not a very long process. The main thing is the swelling when you go home, but as we know, that's a good thing to have.